I'm speaking with the authors of the newly published article, The Data Deficit for Asthma Emergency Presentations Might Surprise You, How Radar Addresses the Data Chasm. Hello.
Hi, how are you?
I'm great, thanks. How are you all?
Yeah, good.
Good, thanks, Melissa.
So I guess starting off, my name is Dr. Daniel Terry, and I'm from a nursing background, but certainly looking at rural health. And I guess the paper itself was sort of born about 2 or 3 years ago when working in a different rural community doing some research. Local community members were concerned about the amount of asthma in the community and their thoughts around industrial or farming sprays being a cause of that. And that sort of was the impetus for looking at asthma in rural communities. And what we initially found was that it wasn't the case at all. But what I did find was there was some challenges in the data that was available, and that after that publication, I thought we really need to do this again, but look at it in a different perspective. And from that time, I then moved to a different university, and I had a conversation with Dr. Blake Peck, who will outline where we got to this paper.
Yeah, thanks, Daniel. So I'm Dr. Blake Peck. I work at Federation University, and I'm a nurse by background, and my clinical background was paediatrics. So when Daniel came to the university, we met early on and had a discussion about how our research might intersect and something we might be able to do together. And Daniel pulled this paper out, and some of the data highlighted that there seemed to be a bit of a hotspot in the southwest region of Victoria. But Daniel was also saying that there's also these gaps in the data that I don't really know how to manage. And I had, by chance, been to a conference that week by the Western Alliance, of which we're all members, and Dr. Kate Kloot, who's going to talk next, and her co-collaborator had worked on developing a database that helped fill some of those gaps. And I said to Daniel, we really need to talk to this person. So, Kate, I'll let you fill us in on that database.
Thanks, Blake. I'm Dr. Kate Kloot. I'm a paramedic by clinical training and also a research fellow. I work for the Centre for Rural Emergency Medicine at Deakin University, and following a project in, I think it was 2011, just looking at the presentations to rural hospitals, urgent care centres, because at the moment only a certain level of emergency department data is collected at an episode level within Victoria, whereas the urgent care centres, they just provide a number, generally just provide a number. They don't provide episode level information. And so we set about to develop a database that's currently collating I think it's 12 hospitals, most of which are from the southwest, to get that episode level data so we can actually find out what's happening at those smaller hospitals. Because at the moment, when I got the phone call from Daniel and Blake and they were reading out numbers to me, I could see in our data that there was a huge amount of information that was being missed from what they were actually able to get from government sources.
And I guess that then brings us to the actual paper itself. And so one of the projects we're working on is looking at asthma in across the southwest region of Victoria to try and identify those gaps. And one of the main findings from the paper is that there's at least a third of information that's currently missing from current government sources, and the radar itself was able to highlight how big that challenge is, and I guess that's now sparked a lot of interest for future projects and things that we're currently working on in identifying what drives or what motivates people to attend emergency or have an emergency presentation in some of the rural and more remote health settings as well. So, but certainly Blake and Kate may be able to mention some of the other work that Radar's been able to address as well.
Look, certainly in terms of asthma, one of the, obviously with a third of the data missing, that's a fairly significant amount that we're able to see it, we're able to interrogate it more deeply and be able to find where some of the areas where we might be able to have an influence, whether it's be asthma plans, so that people can manage themselves in a different way without having to attend the emergency, which is where we sort of began. That's where we thought, is there something we could do in the southwest? But now we know the picture more clearly. We're able to take a greater focus or a sharper focus on what the actual issues are. But just very briefly, this project has borne another project looking at injury in children, because we're missing the same sort of numbers in paediatric population who are injured in the southwest region. And of course, there's lots of money put in to injury prevention strategies, and without knowing how much of an impact those strategies are having, it's very difficult to measure their outcomes. Kate?
Yeah, the other aspect of it too is the smaller hospitals, the really small rural facilities don't have the staff to look at their data on a regular basis. So larger hospitals can have a look at who's coming through their doors, even if it's not being reported necessarily at that episode level to the government, whereas the small facilities just don't have the staffing and the resources to do that. So another benefit of this sort of data is it helps the services themselves have a look at what's coming through the door and improve their own resourcing. And I guess, the policy and planning side of things, it's also assists with that as well, because they've got a much better handle on what's actually happening, and it's more informed than it has been previously.
And I guess just in closing, we, as I said, we're looking at the data in a more depth manner now to identify some of those issues and some of those areas where we could make a difference in the more rural and remote health services. But I guess in the near future, we'll be looking at doing a prospective type study where we're engaging those that are coming into the emergency department with asthma and being able to identify what triggers them to be at the emergency department, and how we can then work backwards and address some of these challenges before it gets to the health service itself. So certainly great things to come forward.
Mm.